If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what kind of bread is okay for diabetes? Answer by Wayne Bodolick. It's not the type of bread that matters, and it's not even bread. The issue is carbohydrates. There are many types of carbs: bread, pasta, rice, corn, potatoes, cake, candy, sugar. As a matter of fact, all carbs are actually comprised of chains of sugar molecules. That's a simplification, but the gist of it. All carbs are broken down to a monosaccharide called glucose, the only form of sugar our body's cells can use for fuel. The simpler the carb, the lower the GI index, the faster it becomes glucose, but all carbs become glucose ultimately. And carbs are not bad for diabetics. They're needed for fuel, but they do have to be managed, and in non-diabetics, that management is automatic. The body's glucoregulatory system does it. For diabetics, there are a few issues here. To start, it depends on the type of diabetic. There are two basic forms of the disease, with variants on each. I'll focus on the two basic forms. In type 1 diabetes, T1, the problem is that the body produces no insulin. Without insulin, glucose can't get transferred from the bloodstream, the body's delivery system, into the cells, which need the glucose. So for a T1, the important thing is to count the carbs in meals, and administer the appropriate dose of insulin at each meal to cover the carbs consumed. For each patient, the appropriate dose is an individual thing. There are many factors affecting it, and each patty and team must learn for themselves what the right dose is for them. But they can eat all the carbs they want to, as long as they dose for it, and they'll keep their BG, blood glucose, in range. But if they overeat too often, they'll get sick from too much weight gain, just like a normal person. T1s also must maintain a regular exercise routine to maintain their insulin sensitivity and to keep their overall health in order, because they're at much higher risk for other illnesses. In type 2 diabetes, T2, the problem is that the body's cells don't respond efficiently to insulin. As a result, their body produces more than normal amounts of insulin. This creates a condition called insulinemia. But at first, before the disease is diagnosed, but while it's developing, that extra insulin is able to keep BG in line. But eventually, as cellular resistance increases, the pancreas can't make enough extra, and BG levels get too high, and the patient gets diagnosed. In these folks, there are two treatment tactics: diet and exercise. By diet, we're talking carb limitation, not elimination. Limitation. Anyone suggesting all carbs are bad or must be eliminated is misunderstanding the whole thing. Each of us needs food to live, and we need glucose to fuel our cells. In T2, the trick is to learn how many carbs the patient's body can handle. Each case is different, because the level of insulin resistance varies by person, as do size, a major factor, activity level, another major factor, metabolic rate, hormonal circumstances, other illnesses, and more. To learn how many carbs a person can handle, a BG meter is necessary. Unfortunately, too many docs don't trust their patients to do this. SMBG, self-monitoring of blood glucose, is the key to learning how many carbs your system can handle, and to then adjust your carb intake to maintain your BG levels within normal, non-D, range, 90 to 120 mg/dl, or 5.00 to 6.67 mmol/L. Here's a useful page on how to do that: test, review, adjust. So, what type of bread is not the question. The question is, how many carbs? Incidentally, carbs are measured in grams, and it's a matter of learning how many carbs a person can handle per meal, not per day or per week, etc. Our BG rises and falls with every meal, exercise session, and stress factor, among other things. So managing it to stay in range is the key. On exercise, you'll hear that exercise burns off BG. And it does. But that is not the reason it's important. Exercise improves cellular sensitivity to insulin, so it addresses the underlying problem in T2, as well as helping in T1. By maintaining a regular exercise, any kind of physical activity, routine, we maintain our cellular receptivity to insulin. A last note, here's a good page on carb counting. https www.bd.com/resource. Asks, answer by Catherine Gilliland. No bread is better for diabetics. To control your blood sugar, you need to limit and find carbohydrates that will spike your blood sugar levels. No bread, no pasta, no flour, no grains, no sugar. Even whole grain is loaded with carbs that will spike your blood sugar. Order a salad for lunch instead of a sandwich. Most restaurants can make any sandwich or burrito a bowl, salad or lettuce wrap if you ask. Ask for an extra serving of any non-starchy vegetables with your dinner instead of a piece of bread, rice or fries. Watch Dr. Bernstein's Diabetes University on Answer by Davina Richmond. Breads are carbohydrates and overall are bad for diabetics. With that said, if you are diabetic, you can eat whatever you want in moderation and trade-offs. If you want bread with dinner, then avoid it the rest of the day. If you want cake, indulge yourself with a bit, but be sure you avoid excess carbs the rest of the day by eating lots of vegetables and protein. Just because you are diabetic doesn't mean you have to give up everything you love. It does mean eating it in moderation and avoiding other high-carb or high-sugar foods. It also means that just because your doctor puts you on pills or injections to help control your diabetes, that doesn't mean it's open season to gorge yourself on carbs and sugars. Pills and injections are only part of diabetes control. There are two other parts as well: diet and exercise.